my name is Diana and I will be presenting the case in lead poisoning in children. The rate of childhood lead poisoning is quite high, with 535,000 young children in the U.S. having harmful levels of lead in their blood. Those under the age of 6 are the most at risk for lead poisoning, and even small amounts of lead can impact the growth and development of a child, as it can relate back to behavioral and learning problems, such as lower IQ, anemia, and hearing problems. Statistically, lead poisoning will affect 1 in 38 young children in the U.S. There have been prevention programs funded by the CDC that have worked in implementing bans on lead in gasoline and paint. Though there is no more lead paint or lead gasoline, millions of homes continue to have deteriorated lead paint because of older homes that were painted with lead-based paint that have not yet been remodeled. And also, this creates an opportunity to educate the parents of potential sources of lead in their homes and potential symptoms. And the threats are to the children in the lower socioeconomic class, as those older homes that may continue to have lead-based paint usually are in the low-income neighborhoods. Some core issues: the hand-to-mouth behavior of young children increases their exposure. They go outside, they get their hands dirty, and then they put them in their mouths, which causes bad health problems. Another issue is the environmental exposure that could be from the drinking water, from the drinking pipe, the soil where they plant their vegetables and therefore eat them. That could be lead contaminated. So the priority should be screening and education on lead poisoning, screening for lead poisoning cases, and educating the parents on lead poisoning. Some alternatives include routine screening programs in high-risk neighborhood, annual lead level screenings in low-income neighborhoods. Another are community-based groups to eliminate environmental-based lead. That could be groups that test the water, test the soil, and also statewide educational programs on lead poisoning made available to parents to educate them on lead poisoning and educate them on potential risk factors. Also, implementation of programs encouraging changes in diet, as many of the foods they eat could potentially be lead contaminated, so encouraging them to change their diets. These all fall back on the social ecological model, specifically the institutional and community infrastructures, as these are the places they live. So focusing on making changes to the institutional and community infrastructures. That goes back to the social ecological model. Recommendations: expanding the outreach and educational programs to every community, not just lower socioeconomic communities, because every community is at risk for lead contamination. Establishing infrastructural changes in regions, changing the water pipes, changing the soil to reduce lead poisoning cases, and also the use of statewide screening programs to test lead levels of blood in children. The short-term action plan would be between 6 months to a year, establishing the community coalitions to abolish potential lead sources, like I said, the soil and the water pipes. And the midterm goal would probably be 2 to 5 years. Keep doing annual screenings for high lead blood levels in children to help find new cases. And the long-term goals would include between 10 to 20 years, finish all majority of infrastructural changes, finish fixing the water pipes and fixing the soil. That could potentially lead to new cases. Hopefully finishing these by 2028. Finally, children are a high risk of lead poisoning because of environmental contaminations of lead. So I would recommend all communities should partake in annual lead screenings and focus on repairing environmental lead exposures. And also, something that was really surprising to me was the fact that you could get lead poisoning from foods you eat. And so I intend to alter my diet to more nutritious foods. And I also would, in my opinion, encourage all parents and individuals to take precaution in buying food to minimize their lead ingestion in their children. So focusing on providing food rich in calcium and iron that is proven to be a lead poisoning prevention. measure. Thank you.